Osteoarthritis. Now, you've probably heard that word before, right? Maybe you know someone who has it, or maybe you felt a twinge and wondered yourself. But what if I told you the name itself is kind of misleading?
What if that little suffix, itis, which we all connect with inflammation, is actually sending us down the wrong path? Well, today, we're going to get to the bottom of what's really going on inside our joints.
And it all starts with that name. To really get a handle on this condition, we've got to get the terminology right first.
Okay, so here's the main takeaway right up front. The term osteoarthritis is technically a misnomer. Why? Because this is primarily a non-inflammatory condition. A much better name would be osteoarthrosis or just a degenerative joint disorder. And you know, this isn't just semantics. It's a really big deal because it completely changes how we should think about it. It's not an inflammatory attack. It's much more like a mechanical wear and tear process happening over a long, long time.
So, if it's not really about inflammation, what is happening deep inside the joint? Let's peel back the layers and take a look at the actual degenerative process.
So what we're talking about is a chronic disorder that affects our synovial joints, the super flexible ones like our knees, hips, and fingers. It all begins with the articular cartilage. Just picture that smooth, pearly white, protective cap on the end of a chicken bone. That's what we're talking about. Over time, it starts to soften and break down. The body, trying to repair itself, then starts growing new bits of bone and cartilage around the edges, and these are called osteophytes. You can also get things like cysts forming and something called sclerosis, which is just the bone underneath the cartilage hardening up because of all the extra stress.
So, what's the main driver here? Well, while there are a bunch of factors, one stands out way above the others. The single biggest risk factor for developing osteoarthritis is, quite simply, age. It's one of the realities that can come with living a long, active life. Now that we have a better idea of what it is, let's talk about where it happens. Where does this degenerative process most often show up in the body?
Osteoarthritis definitely has its favorite spots. It's really common in the big, weight-bearing joints. Think the knee and the hip. It also shows up a lot in the spine, especially in your neck and lower back. And it's also super common in the small joints of the hand, specifically those joints at the tips and in the middle of your fingers, and the one right at the base of your thumb.
And in the hand, this whole process can create some really visible changes. You might see bony enlargements forming called Haberdin's nodes, which are at the joint closest to the fingertip, and Bouchard's nodes at that middle joint. These are actually the physical result of those osteophytes we were just talking about. You can literally see and feel them.
Okay, so we know what it is and where it likes to hang out. But how do you actually get a firm diagnosis? Let's dive into how doctors get a crystal clear picture from inside the joint.
I mean, feeling the bumps is one thing, but how did doctors get that definitive look inside the joint to see exactly what's going on?
The answer, more often than not, lies in a simple X-ray. It's really the gold standard for diagnosis because it lets doctors see the actual structural changes happening to the bone. When a radiologist or doctor looks at that X-ray, they're basically looking for a few key clues. First, they'll look for a narrowing of the joint space. That's an early sign that the cartilage is thinning out. Second, they'll look for that subchondral sclerosis. It shows up as a bright white area on the bone right under the cartilage, which means it's hardened. And third, they're hunting for those osteophytes, which look like little bone spurs growing at the edges of the joint.
So, once there's a diagnosis, what's the game plan? This brings us to our final section, the path to treatment and managing the condition long term.
The approach to treatment is almost always a step-by-step process. It starts with what we call conservative methods, things like managing pain with NSAIDs and doing physiotherapy to build up the muscles around the joint for better support. But if those treatments just aren't cutting it anymore and the pain and loss of function get too severe, that's when surgery enters the conversation. Let's just use the knee as a perfect example. There are two main surgical options on the table. For younger patients, usually under 55, where the damage is limited to just one of the knee's 3 compartments, something called a unicompartmental knee replacement, or a UKR, might be perfect. But for older patients, or when the entire joint is pretty much worn out, a total knee replacement, or TKR, is the way to go.